Rib cutter, detachable. Look at this rib cutter. It's a detachable instrument. One piece having cutting edge, and other piece having round edge to prevent damage while inserting in the thoracic cavity to cut the ossified ribs, which are found in elderly people with increased calcium level, such as Paget's disease. Rib cutter. Next is 19 straight artery forceps. Straight artery forceps, curved artery forceps. These are the scissor-like instruments having a serrated margin over the blunt end and catch at candles which facilitate to lock the instrument so that blade don't open. Two types: straight artery forceps, curved artery forceps. Straight artery forceps, curved artery forceps. Uses: to clamp the cardiac and pyloric end of the stomach to prevent spillage of the gastric content, to strip the dura mater, to check for any fracture to the base of the skull. That is straight artery forceps, curved artery forceps. Twin thread, to ligate the rectosigmoid junction in mass removal technique to measure the length of the fracture of a skull. Curved cutting edge, entering suturing needle with a suture material. Uses: the body is sutured in a crisscross pattern so that the fluid and materials put in do not escape. Electric saw. Councilman's law: to open the skull, cut the outer table while removing the spinal cord, lamina and pedicle of the vertebral column is removed using this. That is electric saw. Brain knife. It is the largest of all knives used at autopsy to make sections of the brain, to make cut sections of the other sold organs such as lungs, liver, kidneys, spleen. All organs are cut along their long axis. Tongue knife. It's a single unit instrument with a handle continuing as a blade. Its blade is longer 2 times than the handle. Width of the blade is less compared to the brain knife. While retrieving the tongue, knife is used to cut the inner surface of the mandible to detach the various attachments. While removal of the various organs in en masse removal technique, to cut open the left and right ventricle of the heart during the dissection of the heart, to cut the costo cervical fascia neck muscles, to cut through the spinal cord to look for any injury. Next is it is tongue knife. Okay. Next is a forceps. 3 types: non-tooth forceps, toothed forceps, rubber tip forceps. Toothed and blood to hold and incise various structures such as skin, dura, great vessels, esophagus during dissection. Rubber tip to hold the bullet retrieved during autopsy as to prevent damage to any rifling markers. That is forceps. Hammer and chisel. While opening the skull, it is used to open the inner table. It is used to remove the pituitary gland from the roof of sella turcica. In case of drowning, to look for mastoid cell hemorrhages, it is used to chip the mastoid cells. And rotor. It is a non-detachable instrument having a pointed blade and a blunt end. Blunt end also as a guiding end to prevent formation of artifact here. Used for opening the stomach and other hollow visceral and organs. If tongue knife is not available, endotomy can be used in cutting opening the right and left ventricle of the heart. Curved scissor. Scissor has a slightly curved blade. Used for dissection and opening of the aorta during heart dissection. It assimilates the arch of aorta. That is curved scissor. Small scissor, Mayo scissor. These are the smallest scissor used during postmortem examination to cut the bile duct, coronary artery and renal arteries, to cut open the common carotid artery in case of hanging or strangulation to look for tear. Medium sized scissor has a pointed and end blade and a cut and blunt end blade. To open fetal skull during fetal autopsy in a flower-like pattern can be used instead of large sized scissor. Preferred scissor for fetal autopsies. Straight artery forceps. Straight large scissor. Large scissor. These are the large scissor used for postmortem examination to open an abdominal cavity by cutting through the peritoneum and rectal sheath. To cut the dura mater and pericardium, aorta, inferior vena cava, trachea, esophagus and pulmonary veins and artery. To cut the diaphragmatic attachment from the inner surface of the thoracic cavity. To cut dura mater in a flower pattern during dissection of the brain. To cut various attachments while removal of various organs. This is bone cutter, non-detachable. It is a non-detachable instrument to cut the first rib while opening the thoracic cavity, to disarticulate or cut through the sternoclavicular joint before removing the sternum. Cartilage knife. It is a single-piece instrument wherein the handle is modified to be continued as a single-edged blade cut through the costochondral junction to remove the sternum while open the thoracic cavity. Scalpel, detachable. Bard Parker knife or non-detachable. Scalpel are made of stainless steel. Two varieties are available. A detachable blade can be replaced and non-detachable single unit handle continuous as blade. Different sizes of scalpel are available to make various incisions on the body to open the thoracic cavity and abdominal cavity while opening the cranial cavity to reflect the scalp, to get the various cranial nerves and tentorium cerebelli while removing the brain, and dissection of the heart for serial sectioning of the coronary arteries, to check for patency in fetal autopsy, to find various ossification center at the elbow angle joint, and to remove the chest plate to make it can differentiate between condition and hypostasis. Magnifying glasses to look for a foreign body in the wound, to differentiate between incisor looking wound and incisor wound, to detect the direction of Grace's aberration, to look for rifling marker from a bullet retrieved from the body during autopsy, to have a better view of crescentic nail mark in cases of throat leak. Syringe with a needle made up of plastic and available in different capacity: 2cc, 5cc, 10cc, 20cc. Drawing blood from femoral vessel in suspected case of poisoning. Draw CSF, urine and vitreous humor for chemical analysis. Magnifying tape, measuring tape. It is made up of plastic and is available with different length. Other variety of measuring tapes and made up of metals also available. Measure the length of the body. Measure the dimensions of the wound. To measure the dimension of organ, for example uterus. Measure the thickness of organ, for example right and left ventricle. Thank you.